A very good afternoon and welcome to the session on the topic recurrent pregnancy losses. We are glad to have Dr. Garima Sharma among us today to help us understand the topic. The doctor will take us through each and every details within the session today, and all the important details will be shared. So stay tuned till the last. Also, if you have any questions, any queries, post that in the comment section so that a doctor can actually answer them. And stay till the last of the session because all the important details and your queries will be taken at the last. Doctor, you may proceed. You have the stage.
Thank you. Thank you, and welcome back to another Facebook Live session. I think the whole purpose of these Facebook Live sessions is to make things simplified for your understanding. Also, to discuss about the fears and the anxieties that the couples face when it comes to planning a baby or when they are undertaking a fertility treatment or a pregnancy journey. And I think the most important idea of these Facebook Lives is to bridge the gap between the needy and the one who's ready to support the needy or to provide the assistance. So, with this motive, for this month, I decided that let's address to one of a very emotionally disturbing topic, which is recurrent pregnancy loss. Now, to simplify it for everyone, recurrent, as the name suggests, means repeated. Pregnancy loss means a miscarriage. And so we generally say that if any woman has had two or more pregnancy losses, but less than 20 weeks of her pregnancy, that's something which is called as recurrent pregnancy loss. Now, a couple of decades back, we used to address this only when a woman would come to us with history of three or more pregnancy losses. But now we know that with the advanced scientific technology, it is very important to first find out the root cause. Why did the woman have a miscarriage, and then plan the next pregnancy? We don't want to add on to the number of miscarriages. So, generally, to the couples, I always tell them that if you've had two abortions or if you've had two miscarriages, please don't rush into another pregnancy. In fact, rush to meet your treating doctor or a gynecologist so that you can narrow down to what was the possible reason for a pregnancy loss and what can you do about it. So this is the basic concept that I'm going to talk about a little in detail. And of course, by the end, as we were told earlier, that I will be open to all the questions. Now, when someone walks to me for a recurrent pregnancy loss, the first and the most important thing is a detailed history of each and every parameter or each and every episode that happened in that pregnancy. So, starting from what was the age of the female and the man at the time of that pregnancy loss. How did she conceive? Whether it was a natural pregnancy or it was a fertility treatment based pregnancy. If it was a fertility treatment based pregnancy, then what was the reason that we did an IUI or an IVF? Whether we were dealing with the egg factor, we were dealing with the sperm factor, we were dealing with the tubes factor, or we were dealing with the uterus factor. When she conceived, was it a single pregnancy or multiple pregnancy? Because multiple pregnancy in itself is a risk factor for a miscarriage. When did she abort or when did she have a miscarriage? It was in the early half of the first trimester, that is less than 8 weeks, or it was in the second half of the first trimester between 8 to 12 weeks, or it was in the second trimester between 12 to 20 weeks. Heartbeat, did it come or it never came? Whether there was any bleeding, any pain. So, these small little things, you might be wondering, why are we being asked for it? But every parameter, every yes and no brings or narrows me down to some kind of a conclusion, or where I can see, okay, that possibly this is the problem, and let me focus on this particular aspect. So, based on whatever information we collect from this history, the next question automatically comes that why are we asking, or probably what are the causes of recurrent pregnancy loss? Now, see, any pregnancy, the most important thing are the two things, right? You have your embryo and you have your uterus. So an embryo has to go inside the uterus, stick to it, and grow for good 9 months. So very simple concept of a seed and a soil. Now, there could be a problem with your embryo. There could be a problem with your uterus. There could be a problem with the hormones, because hormones eventually support the pregnancy. There could be certain autoimmune conditions. And the last or the most frustrating is the unexplained. That is, you have narrowed down or ruled out everything, but you still have not been able to find a cause. So if I'm looking at an embryo, now the embryo quality could be poor because of either the female factor, there's an advanced stage, the egg reserve has declined, or there was a history of endometriosis, or her hormones are too deranged, a PCOS kind of a woman. So wherein the egg quality could be compromised. It could be the other partner, that's the husband, wherein the sperm factor was affected. You could have had a very low count, low motility, low morphology, or a combination of them, eventually leading to a poor embryo, wherein the embryo genetics or the make of the embryo was defective, and that's how the nature decided to abort or terminate this pregnancy. Also, the embryo genetics could be abnormal if one or both the parents are carriers or they have some kind of a genetic issue. So you also start looking at the blood work or the genetic makeup of the parents. Now, when it comes to uterus is a structure wherein there is a cavity where which is called as the womb, where the baby will come, stick, and grow for good 9 months. There is a surrounding wall or the myometrium, and then there is the external part. So you could have problem with the uterine cavity. You could have problem with the neck of the mouth of the delivery, which is the cervix, or can have problem with the myometrium. So when I'm talking about the uterine cavity issues, you could have heard your doctor using terms like thin endometrium, wherein your uterus lining is just not forming. And it could be because you've had previous miscarriages, which led to multiple DNCs and therefore damaging the uterus lining and the thin lining. You could also have issues with the blood flow around the uterus. So that's again because of the adhesion formations or chronic infections like tuberculosis, which reduce or damage the uterus lining, leading to a thin endometrium and a poorly vascularized or a poor blood supply to the uterus. Then some females are born with uterine defects, like a big septum. So these are called as congenital, that is from the birth, uterine abnormalities. So there is a fibrous septum which divides the uterus into complete two halves. And this could lead to a miscarriage because of multiple reasons, like placentation is not proper, the space for the babies to grow is not adequate, right? Then any intracavitary lesions, so fibroids in the uterine cavity, polyps in the uterine cavity, again could lead to miscarriage. The second factor in the uterus is the cervix. So typically there could be certain females where you can have a second trimester loss. Suddenly there is a painless contraction and you see the sac or the pregnancy has just come out. So this generally happens when the neck of the uterus, so the uterus is like this and then you have the neck of the uterus, or which is the delivery of the mouth. So it is supposed to be closed and it is supposed to have a good length, but sometimes it might just open up. And if it open up, the pregnancy can, or the baby just gets aborted. So there could be cervical length issues, there could be cervical strength issues, and which can lead to typically the late first trimester or the second trimester pregnancy losses. Then within the body of the uterus, if you have huge fibroids which are actually distorting your uterine cavity, putting in pressure effect, releasing certain molecules which can impact the implantation and the growth of the baby, or you have a very bad adenomyotic uterus, which is generally a problem seen post 35 in women. So all these uterus causes can also lead to miscarriages. Of course, your timing of the miscarriage would be different. So your fibroids, adenomyosis can cause both first trimester, second trimester miscarriages. Cervical length issues will generally cause a second trimester miscarriage. And all your uterus cavity related issues will cause a early pregnancy, 6 weeks, 8 weeks kind of a pregnancy loss. Then the next parameter comes as the autoimmune. So have you ever wondered, not even two twins, who are non-identical twins will have the same DNA. They have a different genetic composition. A mother's womb, it harbors or it allows a baby to grow for a good 9 months. And this baby is a foreigner to the mother's body. But still the mother's body is able to accept this baby and grow. But in some women, there are these antibodies which can recognize the baby as a foreigner and lead to an immune response leading to a miscarriage. So these autoimmune factors can be present from birth or over a period of time, they can be acquired in the adulthood. So typically, these kind of pregnancy losses are again the 10 weeks, 12 weeks, or second trimester losses. The next parameter is your hormones. Uncontrolled diabetes, uncontrolled thyroid hormones, very severe PCOS, a morbidly obese person. These are few, again, risk factors which can lead to miscarriage. And also, if it's not a miscarriage, it can also lead to abnormalities or difficulties in the last trimester of pregnancy, also. And the last, as we discussed, was the unexplained. Now, once we know that these are the causes, you ask for the history, you see all those parameters, and then you can start investigating. So, investigations have to be thorough. Now, you will need a blood work wherein both the husband and wife, we do the genetic testing of them to understand whether it is the genetics of the parents which is being transmitted to the baby and eventually leading to a pregnancy loss. Then other blood work parameters, you want to know the ovarian reserve. Are we dealing with low egg reserve and an advanced age with leading to a poor quality egg and eventually a poor quality embryo? You also want to look into your autoimmune factors. So there are blood work for congenital autoimmune factors and the acquired factors. So you must have heard terms like APLA syndrome by your doctor. And also look into overall health parameters. So do a detailed examination for your thyroid, for your hormones, for your sugars. So all these parameters have to be also evaluated. Then at the same time, a good 3D sonography to look into the uterus cause. So a detailed examination of the uterus cavity, the cervix, and the entire uterus parameters, also adjoining structures like endometriotic cyst or fluid in the tubes. You want to look into that. And the last is advanced sperm function test for the males, that even though your sperm count might look normal, but because of the age related changes, there could be damage to the DNA of the sperm head, and which could be leading to a little poor quality embryo and the miscarriage. So you do these tests. Now, once we have the reports, the treatment is you have to treat the cause. Now, if it's an embryo suspicion, so you are dealing with either an egg factor or a sperm factor or a combination, you would need a fertility treatment. And to be precise, in these given situations, IVF with pre-implantation genetic testing, that is, you test the genetics of the embryo before you transfer that embryo, and then you see if it is a genetically normal embryo, only then you transfer. A genetically abnormal embryo, you just discard it. Now, if it's a uterus related issue, you need to surgically correct it. So if it's a septum, a polyp, any kind of a fibroid, you are seeing adhesions, you have to put in a hysteroscope, that is a telescope into the uterine cavity. You might even need a laparoscopy, and you correct the pathology. Now, based on what is the extent of the surgery, you have to give a good healing period of bare minimum of 1 month to 3 months, depending on what you have treated, before you start looking out for a pregnancy. Now, if it is an autoimmune factor, so autoimmune factors can be treated with the usage of blood thinners. So, blood thinners in terms of oral tablets and injectables, we started the day we see a positive pregnancy, and then they are continued generally depending on what was the parameter that we saw, whether you stop it in the first trimester or you continue till the third trimester. Now, work on your sugar control, thyroids, obesity. You have to plan your pregnancy. You can't be pregnant with, a morbid obesity, because we don't want complications. We want a good 9 months of journey with a happy, healthy mother with a healthy babies. So, obesity also has to be managed before you start looking out for pregnancy. And despite doing all these parameters, if it still comes out to be an unexplained, we still suggest in those situations that probably an IVF with pre-implantation genetic testing, with a good progesterone support, consideration of blood thinners like ecosprin can be taken care of. Very rigorous pregnancy management, because we have seen a lot of times that people will just do a UPT and directly come to us at 8 weeks. So early pregnancy scans, because you want to see what's happening, the baby is growing properly. Do you need any medicated support to prevent these kind of miscarriages? So the whole idea of managing a recurrent pregnancy loss is a detailed evaluation, narrowing down your probable causes and identifying them, and then treating the cause. So, as I said, one very important thing in the beginning, getting pregnant is not a problem, but carrying a pregnancy is a problem in these women or in these couples. So rather than rushing into another pregnancy, please take a pause. Come discuss with your gynecologist or your fertility expert, get yourself evaluated, and draw a plan. Now, all these things that I talked about will not make your pregnancy loss chance to 0%. But from a recurrent pregnancy loss, repetition incidence of about 30 to 40%, all these measures that if we take can reduce our pregnancy loss incidence to about 1 to 2%, which is seen in your natural pregnancy also. So I very strongly believe that when science meets hope, little miracles do happen. So, my dear friends, please believe in the system. If you have any issues, rather than resorting to unjustified or uncertified knowledge, it is better to connect with the concerned specialist. Thank you, and I'm now open to all your questions. So I hope I was able to deliver the message. But still, if you have any questions, you can always connect with me on our official website. Thank you.